Welcome to your module on cracking the code, an introduction to ICD-10 coding. I'm Dr. Julie Pennick, one of the faculty in the FNP program. So what's an ICD-10 code and why do you need it? Just like the CPT coding system, the ICD-10 coding system is a standardized classification of codes that correlate with established diagnoses. Why is that important? In order to properly process billing to third-party payers or government payers for reimbursement of services provided, you're going to need to have the appropriate ICD-10 code identified on your billing. ICD-10 codes are also used when you order diagnostic tests as a justification. That is a necessity for that test to be conducted. Prescription medications to be reimbursed require appropriate ICD-10 coding. The ability to order and have your patient receive medical equipment is dependent on appropriate ICD-10 coding. And then when you refer your patient to other providers or other levels of care, the ICD-10 code becomes an important consideration. The ICD-10 code system is the latest version of the International Classification of Diseases. The code system is updated frequently, and it would be incumbent upon you as you're out in your practice to keep up with the changes. Take a look at the cartoon. A farmer comes into the office, having experienced a mishap, it appears, with a goat from the farm. The front desk individual at the office says, "I'm sorry, Mr. Johnson, I've checked everything. Your insurance company's not going to cover your visit because there's not an ICD-10 code for this." Now, the reality is there are a number of ICD-10 codes that could be assigned to this encounter. Impaled object, I'm sure, has an ICD-10 code because there's almost 72,000 ICD codes out there available for you to choose, making the likelihood that you would be able to find at least one code to be able to assign. ICD-10 codes have a structure. They're all going to have a base of 3 characters, letters, and numbers. There can be the addition of up to 7 additional characters of letters and numbers for further defining a higher level of specificity for the diagnosis that you have assigned. And here's an example of that. The ICD-10 code for type 2 diabetes is E11. Without complications, you have the introduction of the 4th character. With other diabetic ophthalmic complication, you have the addition of 2 additional characters. With the addition of unspecified diabetic retinopathy without macular edema, you have the addition of 3 additional characters. And the same goes for the last category on the slide. ICD-10 symptom coding. If you've not been able to glean from your subjective and objective data sets that you've collected a solid diagnosis, then choose a symptom that the patient is presented with and code based on the symptom. Once you've made a final determination, when perhaps diagnostic or imaging studies come back and you can assign a specific diagnosis, you can replace for future encounters with the patient the symptom ICD-10 coding with the diagnostic coding. Here's another cartoon suggestive that coding and billing has to do with manipulation for reimbursement. Caution, make sure that you code appropriately. So here's the recap. ICD-10 coding becomes important for a variety of processes, including billing, justifying, ordering diagnostic tests, for the patient's ability to have prescription medications paid for or to obtain equipment they may need to assist them with their mobility, and for your referral processes to other levels of care or providers of care. Here are our references, and thank you for your attention.